Now, after talking the kidney disease and pregnancy, let's talk about another important topic, the heart disease and its effect during pregnancy. So in this section, we will talk about different stages of the heart disease, counseling of the patient with heart disease, and also risk factors associated with the heart disease. First, the heart disease. Pregnancy usually have its own effect that can cause more pressure on the heart and the vascular system, circulatory system. So pregnancy, what are the normal physiological responses of pregnancy? We have decreased systemic vascular resistance. So vascular resistance is low, decreased during pregnancy, 10%. There is progesterone and no prostacyclins. Increased carbon monoxide 30 to 50%, stroke volume and heart rate is also increased. There is increased coagulability during pregnancy or increased coagulation, increased consumption of oxygen. There is increased blood volume, which is about 40 to 100% increase, and increased red blood cell mass is about 25%. So all these are the normal physiological changes that occur in the cardiovascular system, which is the system that includes the heart and the blood vessels. And as a result of these normal physiological changes during pregnancy, they have different impacts on different functions. So let's see what occurs as a result of these changes. So decrease systemic vascular resistance 10%. This cause increase right to left shunt, and then increase carbon monoxide 30 to 50%, stroke volume and heart rate also leads to right to left shunt, and this can lead to congestive heart disease. Then increased coagulability cause pulmonary embolism. As a result of increased coagulation ability, there is thrombosis formation, and from the thrombosis, a piece sometimes dislodges and form embolus, and this embolus can block different parts of the body, different blood vessels. And if it reaches the lungs and cause blockage there, this can cause pulmonary embolism. Then increased oxygen consumption cause right ventricular dilation and right ventricular failure. Increased blood volume and increased red blood cell mass can also cause physiological anemia. So these are the different changes. Next we have these pulmonary embolism, and then right to left shunt cause hypoxia because of decreased supply of oxygen to the body. They also cause hypotension. During the pregnancy, the blood pressure is normally lower than the usual because of increased blood volume, and because of decreased resistance to the blood flow. Then this can also lead to left ventricle underfilling, decreased carbon monoxide. As a result of hypoxia, which is decreased supply of oxygen, leads to acidosis. Acidosis cause increase in peripheral vascular resistance, can also cause shock and respiratory failure. Decreased blood volume, vasovagal reflex also occur as a result of hypotension. There is with the delivery, then we have venous return increases, decreased blood volume, vasovagal reflex, and we have also these complications as a result of delivery. So there are normal physiological changes during the pregnancy that can cause different effects, including hypotension and hypoxia. And these hypoxia can cause acidosis and increase peripheral vascular resistance. With the delivery, then we have increased venous return, and there is decreased blood volume and vasovagal reflex. So this is the effect of pregnancy. Next, stages of the heart failure. Stage 1 is mild stage. There is no limitation of physical activity. Stage 2, slight limitation of physical activity. Stage 3 is now the moderate stage, in which there is marked limitation of physical activity. And then severe stage is the stage when they unable to carry out any physical activity without discomfort. So stages of heart failure: normal physical activity, and slowly the physical activity becomes more difficult, and they without any discomfort, like they have shortness of breath because of decreased supply of oxygen, or hypoxia, dizziness. All these things can occur as a result of heart failure. Especially shortness of breath is common. Even when they move few steps, they have shortness of breath as a result of decreased supply of oxygen to the body. Then pregnancy counseling, optimize the medications to treat the heart problem or heart disease. And then surgical correction before pregnancy is important. So if the patient has heart disease, they should be treated and then corrected surgically before any pregnancy is planned or before the conception. Issues in counseling of women: risk of maternal death, possible reduction of maternal life expectancy, effects of pregnancy on cardiac disease, mortality associated with high risk conditions. So it's very important that proper counseling should be performed, and women should be aware that what can happen to them and to the baby if they conceive, and how they can be treated, and what are the risks, because it can affect their mortality and reduce the normal life expectancy. Risk of fetus developing congenital heart disease is also there in mothers who have heart problems. Risk of preterm labor and fetal growth restrictions, as in kidney disease, it's also possibility in heart disease also. Need for frequent hospital admission. These women should be admitted to the hospital frequently for monitoring and for doing the assessment of the fetus and assessment of the mother, whether the pregnancy is progressing normally or not. Intensive maternal and fetal monitoring should be performed. Contraception, adoption, and surrogacy. One alternative during conception, these women should be always tell them that they should have contraception, and if they cannot have pregnancy and they cannot have children, they should do any time they can adopt or do the surrogacy, which is a procedure in which the papers are signed, and then some female on behalf of the couple who cannot have children, they conceive and then they give the child to the couple who do the documentation or arrangement with them. Timing of pregnancy is important. Once the baby reaches the stage of viability, then the pregnancy or delivery should be performed. Antenatal management, outpatient management, then echocardiography should be performed, anticoagulation therapy should be given, and then the markers are first, prior episode of heart failure, arrhythmia or stroke, then New York Heart Association class more than 2 or cyanosis, left heart obstruction, reduced left ventricular function. All these are the markers in which patients should have proper antenatal management to improve the outcome of the pregnancy and to reduce the fetal and maternal mortality. High-risk cardiac conditions, systemic ventricular dysfunction, pulmonary hypertension, cyanotic congenital heart disease, aortic pathology. All these are high-risk cardiac conditions that should be managed. Ischemic heart disease is also another condition. Left heart obstructive valve is another high-risk cardiac condition. So systemic ventricular dysfunction, pulmonary hypertension or cyanotic congenital heart disease, aortic pathology, any problem in the aorta, is the largest artery in the body, aorta. This is the aorta here, aorta, largest artery in the body that carries the blood from the heart to the body. Any abnormality of the aorta is also high risk condition. Ischemic heart disease. Ischemic heart disease is a disease in which there is decreased supply of oxygen, and then we have left heart obstructive valves, obstruction of the valves on the left side of the heart, that can cause high risk cardiac condition. Then we have previous peripartum cardiomyopathy condition in which there is involvement of the heart muscle around the pregnancy, around the time of the pregnancy. Any previous history of cardiomyopathy, it should be also taken under consideration. So all these are different conditions, high risk conditions. Patients with these problems, usually they have hard pregnancies, serious managements can be performed and then should be performed, and then another alternative should be given to the patient that they can anytime adopt and do surrogacy. Fetal risk of maternal cardiac disease, there is recurrence, maternal cyanosis, iatrogenic prematurity, fetal growth restriction, effects of maternal drugs. All those were the fetal risk during the cardiac disease. So, thank you for watching sqadia.com.